Let's take a look at your sprained ankle anatomy because in order to really take care of an injury, you have to know what's wrong with it. So there's two types of very common ankle sprains, but one is by far more likely than the other, and that is the inversion ankle sprain rather than the eversion ankle sprain. You have a lot more motion turning your feet in than out, as I'm sure you could probably tell looking at your foot right now. And thus, the ligaments on the outside of your ankle, which are stressed as the foot turns in, are much more likely to tear than on the inside of the ankle. Not to mention, the inside of the ankle has much stronger ligaments, has more of them, and they're wider, with less joint range of motion. So, with an inversion ankle tear, there's three grades, but they can usually stretch, partially tear, or tear. Now here you have an example of a tear of the anterior talofibular ligament with a partial stretch of the calcaneofibular ligament. And I'm going to show you how to quickly take care of that with anti-inflammation to cut down your healing time from weeks to days if it is stretched, and from months to weeks if it is partially torn. So on the outside of your ankle, you have three main ligaments that are damaged. The most common is the anterior talofibular ligament. That prevents your foot from turning in and down. The second most common is the calcaneofibular ligament, which prevents your foot from turning up and in. In any injury, the anterior talofibular is always the first injured. You usually don't have any other ones injured unless this one's injured first. The PTFL is very infrequently injured unless you have a very severe ankle sprain. And this ligament up here, I'm going to get to later, but this is between the two leg bones and is only seen in high ankle sprains. The deltoid ligament, there's 5 ligaments here. There's two deep, deep and a superficial here, a deep and a superficial posterior, and just a calcaneo tibial ligament, but these are infrequently injured, but there is 5 of them, and usually the ones towards the front here are injured as the foot turns out. And as I mentioned, with high ankle sprains, the inferior talofibular ligament that holds the tibia and fibula together can be sprained if these two bones are brought apart in a severe sprain. You also have 2 tendons in your foot, the peroneus brevis and the peroneus longus. These ones could be damaged with a severe inversion ankle sprain. So I mentioned again 3 grades: tearing to partial tearing, or stretch to partial tear to full tear. And here's the full anatomy: anterior talofibular, calcaneofibular, and the 2 tendons coming across. This is in a lateral ankle. So first grade is a stretch. This could keep you out of action 3 days to 2 weeks. Now, the reason I put such a vast difference here is you could have a slightly worse one, but the main thing is the treatment. You want to control the inflammation before it gets swollen and before your inflammatory and white blood cells get in there and start attacking it and breaking it down. What you want to do is immediately ice, elevate, and compress it. The ice is huge. Get it on there for 15 to 20 minutes. As soon as possible, within half an hour is ideal, and this will stop the inflammatory cells from breaking down the tissue further. This will cut down a significant portion of your healing time. Get some anti-inflammatories. Get a good ankle brace. Elevate the foot. This is all to increase healing, not just to decrease pain. Now, a partial tear. You're going to have a lot more bruising, a lot more thickness and swelling. This can keep you 2 to 4 weeks because the ligament is partially torn. Now, you want to do all the things I mentioned before: control inflammation, but also possibly go see a doctor, get some physiotherapy to prevent chronic long-term instability. Now, complete tear. This is when it starts getting ridiculous. When you have really bad swelling and ecchymosis like this, which is the purple color. So it could get as bad as this in a stage 3, where the ligaments are torn, you possibly have ankle dislocation, broken bones, or cartilage damage. You want to see your podiatrist. You could have cartilage damage as shown on this MRI. You could have ligament rupture. You could have broken bones. So you want to go see a doctor in this case if it is that bad.
Do not try any of this at home alone without supervision. This is presented by Michigan Foot Doctors. If you think our information helped you, give us a thumbs up and come visit the site for even more.